All right, well, welcome. So I'm going to be talking about this not only as a program, but as its own specialty in nursing practice. And my background is I'm a retired colonel. I was 22 years in the Air Force, everywhere from the battlefield, flight nurse, critical care, commander, IG. I worked at the Pentagon. I was the medical director for the Air Force Reserve, and then a special advisor to the Secretary of the Air Force. So everything from soup to nuts, it seems like. My background in nursing is I've been a nurse for 35 years. I was active duty and then reserve and then active, but my reserve time I also taught at different universities, at 5 different universities. So I had this background in academia. I had also been married to someone in the military. So I also had this insight as a family member and a spouse of somebody who deployed multiple times. I don't even think we could count. And then also I was a patient. So as with 3 cancers, I really got to see the system in depth for my own self from both in the military and the VA. And, you know, with all of that information, it really brought me to forming this program and seeing this as a specialty area of practice. So I was first doing some research with a partner at University of Colorado, and we were starting to do more initiatives and innovations around our veterans. And I was looking at this as a new specialty and area of practice, that we have this unique delivery system, and that there really are very specific service-connected conditions. So I started out with this to show it and be able to create this with kind of a research question. Is this a unique specialty? And I did a lot of interviews and focus groups and looked at the history. I found that specialization has always existed from Greek Roman times to the present, that a lot of our modern specializations, the criteria changed over time. It's gradually evolved. It's different between different countries. And sometimes it can be somewhat arbitrary, and sometimes it's really specific to a category, and sometimes the categories overlap. So there are some examples of different categories, whether you're looking at age of pediatrics, geriatrics, or a system like cardiology, or a holistic system, or then you can have pediatric cardiology. You know, so like you can put these together in different ways. I really saw that military medicine, our veteran care, you know, maybe that was population, maybe there's also a cross with environment, but that sometimes the categories are not exclusive, and a lot of times things do overlap. In looking at both the American Nurses Association and the American Medical Association and other professional organizations, this was some common criteria that I saw across the board for getting recognition of creating this clinical specialty. And one is it needs to be clearly defined, and it has to define competencies. And I think we have those. I'm just not sure how clear we are about the definition. The other part is has to having defined educational criteria for the specialty preparation or a graduate degree. And this is kind of where I started, because I felt like we really met most of the other criteria. We had national and international systems. There's a substantial number of practitioners, hundreds of thousands actually. And we do have different organizations that relate to the care that we give. And our care for our veterans, we have our military health system, our VHA, and then care in the community. And these are all, well, mostly the VA and the MHS, the military health system, are congressionally mandated systems. And really, Congress was not set up to take care of a healthcare system. I know we look at Congress now, we go, really? But change is literally an act of Congress in the system. And I have great respect really for our policymakers and our congressmen and women. It's just, this wasn't really supposed to, it was supposed to be kind of like a minor part of the law, and it's become a major piece of legislation that has continued and has affected all of our beneficiaries. So roughly 30 million beneficiaries, roughly 200 billion a year. I believe both those numbers are low at this point, and over 200,000 licensed providers. And over, I would say probably at this point, over 4 million with a service-connected disability. So we have this huge population you can say is a definite need. We put a lot of money into this system. Our VHA is geographically disparate. We have 172 medical centers, over 1,000 healthcare facilities, and do over 100 million outpatient visits a year. And our military health system, they also have over 100 million outpatient visits a year, even though it's a lot smaller of a population. It's really like one to three. The VA is twice the size of the military, but they really need to assure the medical readiness. So our troops are really integrated with the military health system from day one, actually from even before they come into the service. And I think one of the last statistics I read is less than 15% actually medically qualify now to come into the military. And that's how integrated health is with our troops and throughout the time that they're in service. Care in the community is way more difficult to quantify, but somewhere between 60 and 80% of veterans seek some degree or level of care in the community, and 1 in every 10 patients is a veteran. And interestingly enough, 1 in 4 dying patients is a veteran. And our community providers, this is not a surprise to anybody who works with our veterans. They're just not as familiar, if at all, with military culture, with the service-connected conditions, and they may not be comfortable, and probably are not comfortable, asking the questions or really digging in and even knowing what questions to ask. So after all of this exploration, I said, we definitely have an identified need and demand with hundreds of millions of visits and the large number of veterans and service members with PTSD and mental health conditions, blast injuries. We have a very discrete body of knowledge, and we have a large research-based, and we have a lot of evidence-based practice. We have a substantial number of practitioners. This is practiced around the world, and we have different independent associations. I know the VA has a Nurses VA Association. There's the AMSIS, which is the Society of Healthcare Professionals now, which is more focused on the military. But there's also an International Committee of Military Medicine. So there's several different, both national and international associations that represent this area of practice. And while this is more of a military slide, you can see that the work that the military does is way different, and the exposures are way different when they get to the VA. So when I came to the VA, we were looking at education, research, and forming collaborations and partnerships. My main interest and what I was mostly responsible for was creating the graduate education. We now have 6 specialty courses plus an internship. We have a graduate certificate, a master's of science, a PostMaster Certificate, and a combination of the master's and PhD, or a combination also of the master's and DNP, a PhD emphasis area, which is looking at becoming its own track, and a DNP that started this past fall. All of the courses are delivered online. It is an interprofessional curriculum and is open to all healthcare providers, although some of the degrees are only open to nurses. And the faculty is a collaborative team from the VHA, the military, and academia. The graduate certificate is 12 credits. Like I said, it's online, it's interprofessional. It is graduate, so it's post-baccalaureate. It could be postmasters. I've had PhDs come back and do the graduate certificate. And equally across the board, they have all found it to be extraordinarily valuable. The Master's of Science has a 12, this is only for nurses, has a 12 credit core. Similar to most schools, in policy, leadership, informatics, and theory. Then there's our specialty core of veteran and military healthcare of 18 credits and an administrative practicum of 2 credits. So that is 32 credits. The PostMaster Certificate is basically a second master's degree, so there's no need to take the MS core if you've already taken those courses, and you just take the specialty courses and the administrative practicum and receive the second master's degree. It's termed a PostMaster's Certificate, but it is equivalent to another master's degree. The PhD emphasis area, you can take 3 of the courses, 9 credits, and use it. And if you just elect to go on to a PhD, or if you decide to apply to the PhD, you can use the 9 credits of the specialty content for your dissertation and your coursework, provided that you're studying the veteran or military population. The DNP is super exciting, and I'm like so thrilled that we started. It's got some great reviews even just early on, and there's been a lot of excitement about this. It's a combination of what we have in the veteran military healthcare specialty, and we add some leadership content, and it's a focus really on becoming the specialist of veteran and military healthcare at the leadership level. You can go right into this from the BS degree to the DNP. You can have a master's and go into this. You can do a postgraduate DNP. If people are out of state, I highly recommend that if they decide to apply for the master's, to think about, or talk to me about one-on-one about your circumstances, because sometimes it's more advantageous to apply for the MS to PhD, or it's called the BS to DNP, I'm sorry. And with that, you still get your master's halfway through, and then you can decide if you want to continue on to the DNP, or you can cycle off at the master's and still have your master's degree. If you take the master's and it's 32 credits, all of that transfers into the DNP. So you can do it in 2 steps. You can also elect to apply BS to DNP and decide after your master's if you want to continue. There's also some financial considerations with that. The VMHC master's is at an in-state tuition rate. And so if you're out of state, that part of the program is at the in-state rate. When you go into the DNP, you pay the main campus rate, and that might be the out-of-state. But even if you do the BS to DNP, while you're in the master's level, you only pay the master's level and the in-state rate. So it's a little bit confusing, but I wanted to make that clear, especially since I know some people here might be from out of state, to understand that there's some financial considerations to think about. So those are some of the options. All of the applications for the master's and the DNP, or the BS to DNP, or the combination master's and PhD are in nursing CAS. Anything to do with the PhD is a separate application to the graduate school. Now, if you want to combine the veteran military healthcare content with the PhD, you do have to do both applications. So just to be upfront about that. I want to take a few minutes and talk about the courses, and then just open it up for some questions. These are the 6 courses that we have. We start off with a systems course, and then we look at the psychological healthcare of the veterans and the service members. And because our service members are not alone, we also see what's happening on the home front and how we support our veteran and military families. Wounds of War looks at our disability evaluation system. And then we have a specialty course on women in war, which is very humanities perspective. And the Caring for Veterans, Chronicity, Aging, and End of Life is a whole of life centered course, basically starting from when you enter the military to end of life. So a little bit more detail about each of these classes. If anybody has questions in the end and wants to see one, I can open one up. The healthcare systems, military and veteran healthcare systems, I mentioned before, making a change is literally an act of Congress. So we have this very socio-political, economic, ethical, and current national healthcare issues that really need to be taken into consideration with the way in which we deliver care. So this course looks at our overall structure, the functions, the processes, and what kinds of policies we have on guiding, regulating, and organizing this delivery of care. Home from the Battlefront, Psychological Healthcare for Veterans and Service Members. To me, this is by far the most fundamental course in the entire curriculum. This is when we want to approach a person holistically and really understand them, this course has that kind of approach. We're trying to understand the psyche, the whole person. This is an introduction to veteran and military culture. We look at a historical perspective. We go back in time to Greek-Roman times. We look at other cultures around the world. In this course, we also take a more in-depth look at PTSD, TBI, suicidality, and the effects of the member's service on the family and parenting. And this is from the member's perspective. We also look at issues related to diversity, reintegration, redeployment, navigating the healthcare system, and some ethical issues. And I have to say that healthcare navigation, even for me with a PhD and knowing these systems so intimately, it was a challenge. So I really feel for those service members and veterans coming into it that don't have a background and don't always know what's the right question to ask. And if compromised by PTSD or TBI, it makes it all that much more complex. So to me, this is a very fundamental course in the curriculum. But our members are not islands. They don't generally live alone, and they're part of a larger system of their families and their communities. So we have this course supporting our veteran and military families. And from their perspective, the issues of deployment, reintegration, parenting, what are the fatigues? What's the sequela of living with combat stress? And in this course, because it is sort of on the home front, we take a look at how we can support our civilian providers and what type of family care interventions we have. The fourth course developed was on wounds of war, military and veteran disability evaluation. And from the military perspective, this is whether or not they're going to be fit for service, whether or not they're fit or unfit. This disability evaluation system, I know the nomenclature sounds very strange sometimes. Like, why are we talking about this as a disability? But this is legal language. This is based in the law. And this law is 70 years old, and we're still using it. We've had thousands of incremental changes to the VASRD, and all of our even fitness for duty or our access to care and how we measure a veteran's the impact of service on a veteran and then what their subsequent benefits and access to care would be is based on this law, and it's based on this disability evaluation. And unfortunately, there's not a lot of education around this, and there's not a lot of understanding of what goes into it. And if we don't ask the right questions, if we don't do the right assessments, and when I say we, I'm just really talking generally for all healthcare providers, and we don't document it, that can change their benefits and access to care for the rest of their lives. And so this is a very important course. There are times when I've asked the students many times, actually almost every time, I say, do you really think we need this course in the curriculum? And like hands down, they're like, yes. Some have said, I want to take it again. And I'm like, why? You already took it, you have an A. And they're like, no. This is such important content to understand. So of all the courses, I think this is probably the most specific and tactical of a course, but it also pans everything, both military and veteran systems. The women in war. This is a very exciting piece of the curriculum. It's very different. It's a humanities perspective. And when we're dealing with people, I really feel like it's important to get down to some of like what's going on for the people in this system. And this course was developed with anthropology, with health and behavioral sciences, and public health. So while it's focused on women in war, I feel like it gives even a great perspective on diversity. But for women in war, it's also looking at the civilian women and the military women. We have an increasing number of women in the military, and there are some gender-specific policies that we look at. We look at deployment considerations. Unfortunately, military sexual trauma is prevalent, not just for women, also for men, but more so for women, and the psychological effects of deployment. The female experience, or the woman's experience in the roles in the family and reintegration to community, is different in many ways than it is for a man, just because of the roles that women tend to play in society. So this is a really interesting course, and I think what's nice that it was developed across disciplines and campuses is that we get a lot of other people in the course, from public health, from gender studies, from anthropology, from health and behavioral sciences, and the level of dialogue is so enriched by all of these other perspectives. And then the last didactic course developed was Caring for Veterans, Chronicity, Aging, and End-of-Life Care. And of all the courses, I have to say this was the second most foundational course in the curriculum. This takes that whole lifespan approach, what happened during service, looking at all of the environmental exposures, even in garrison time, or if they're working with nuclear material. You know, what was their military job? Their military job is going to have an effect on them for their whole lives, whether or not they deployed. And how is it different in each era of veterans? How is it different for World War II, or Vietnam, or Korea, Gulf War? We still don't even recognize Gulf War as its own illness. We label it multi-symptom chronic illness or something like that. But how can a person suffering with all of those conditions have any affirmation that something actually even happened to them, when we can't even say that that's an illness? So there's just very in-depth conversations. In fact, this week we talked about our Iraq and Afghanistan in this class, and there was just so much discussion and so much understanding of what goes on for each era of these veterans and what their needs are. The very last capstone part of the master's is an administrative internship, and where you get to apply all the content into your area of practice. There's no way I can teach everything, or that we can teach everything that goes on in the VA or the military. But this is information that spans all different areas of practice and all specialties, and you can apply it in your area. And I really ask the students throughout the entire curriculum to do their projects on things that are meaningful to them, and things that they can use at their hospital or their clinic, or with the cadre of people they deliver care with, or into their community. One of the students this year did her project on the school system and how the schools work with the military children. And she was in the military, was a commander, but her focus was on her 4 kids, and she wanted to understand how they were being supported in the community. I've had people work with the homeless, people work with VA and like our exposure assessment and our military history, and where is that in the chart? We've had people work with coordination of care from the military to the VA and the community, and how we coordinate care between those so that the records can flow. One person did a philosophical inquiry about the logic of veteran identity and how that can apply to adherence for treatment. So you can see this internship can go in any direction you want it to go in. I really want to support students to take this into an area and use the information in a way that can bring them to the next level. Oh, and the one other one I would want to mention too that's a little bit different is the person right now is doing it on workplace violence and violence by veterans in the emergency rooms at the VA. and how to work with that. So I mean, like I said, this can go in very many directions, but understanding the depth of the veteran content, veteran military healthcare content, is what I want to see it about. So back to the finances. I know everybody always has questions about finances, and so I try to address some of that. Our extended studies rate is $7.11 per credit hour plus fees. That's the in-state tuition rate, and that's for all of the master's level courses. So if you do the BS to DNP, you pay this for the master's level, and then when you get to the DNP level, you pay the out of state if you're out of state. If you're in state, you just pay in state. Most employers provide tuition reimbursement. Another question that is always asked but isn't on this slide is whether or not we're accredited. Yes, this is a fully accredited program to, I believe, 2030 maybe. We just went through accreditation. So we have 10 years left to go. The military has tuition assistance. You can use your GI Bill. I've had people use that. There's continuing education funds or tuition reimbursement at the VA. If you're eligible as a nurse for the NNEI scholarship, I've had people use it for the entire DNP program and for the master's program. And it covers tuition and fees and books, I believe, for the entire program. So there is a payback for the NNEI scholarship, but I would think that would be to your benefit. So that's, I do try to support anybody going to the NNEI scholarship and need to know that in like our first interview, because there's special paperwork that you'll need from my end. And now that I've done it so many times, I just kind of keep it on hold and I try to make that specific to each person. Our admissions process into the master's and DNP programs is through nursingcas.org. There's 3 letters of recommendation, official transcripts, there's an application fee to Nursing CAS and a supplemental fee. I know we're coming up very close on the December 15th deadline. You just have to request your transcripts and recommendations. They do not need to be received by December 15th to apply, but you do need to submit your application by December 15th, whether or not the transcripts and recommendations are in place. So as long as you submit, even if those items are pending, we can process your application for admission. So I can't stress enough how important that December 15th deadline is. It's like near impossible for me to get that changed. But I can get them to accept the transcripts and recommendations later. So we have that bit of flexibility. I'm sorry I don't have the deadline off the top of my head for the PhD, but that's through the graduate school. And if you're interested in that, then I would encourage you to talk to myself or Dr. Jackie Jones, who is the PhD director. And that is another really important point of contact for you if you're considering a PhD. Trying to think if there's anything else with admissions. There are other items required by Nursing CAS, but the items I get the most questions about are those 3 letters and the transcripts. And that's why I kind of talk about that specifically. There's one essay, and really in that essay from my programs of the veteran military healthcare, I'd like to see you explore why you want to study it with this population, why it's important to you, why it touches your heart, why it's meaningful. I mean, those are the things that help me understand if you'd be a good fit for the program and what your journey is, and is this the right next step for you? I think I said almost all of this. Degree programs apply through Nursing CAS. PostMaster is through Nursing CAS. The certificate program or individual courses are different. So we do have some other ways to come into the program. You can take individual courses and start right away, and this is through extended studies. I do recommend that people, especially if they're coming from out of state, say they're going to the certificate program, even if they're just starting with one course and then they're going to decide. One, for several reasons. And my reasons are that in the certificate program, you get the in-state tuition rate, which is not necessarily true of just saying, I'm just going to take one course. So apply for the certificate is my thing. And I found that a lot of people that say that I'm just going to take one course end up taking many more. And even though it's only four for the 4 of the 6 specialty courses for the certificate, many people take all 6. They want all of the information. So I've seen that time and again. So I just say, if you're gonna even take one course, say go for the certificate. Now, if you apply for the master's or the DNP and you wanna start early and say, I wanna start this January or this summer, you can start right away by taking a course through extended studies. And that will flow and transfer into your degree program. So you can do that. And then if we know that we have an application in process, you don't have to apply for the certificate program. You can just say, I want to take this class. I want to start early. Not a problem. You still have to go through the extended studies application just because we need to know that you're coming into the program. We need to give you the right codes to register. So that is another possibility for those that are interested in coming in that way. I'm trying to think if there's anything else about the certificate program or the individual courses. I think that pretty much covers it. And you can always reach out to me if there's other questions or if you're not sure. We have another program called Nexus, and that's for PhD students across a collaborative organization that's Nexus, and we share all of our courses, and it's at a specific fee. And so if you're in a PhD program and you want to take one of these courses to support your dissertation, we have an application available through Nexus. I also neglected to say that there's a WICHE, which is the Western Institute of Higher Education, something like that, Commission for Higher Education. And the WICHE, if you're part of the WICHE states, you also get in-state tuition. So as you can see, I am not really the financial person, but I've had to learn a lot about it. So I try to give as much information as I can that I know is true. There is more information online, and there are other resources. I have to say that the students have been so positive in all of the evaluations I've received. When I say my courses are rated on a 5.0 scale, an average of 4.9. I would say across all of them, somewhere between 4.8 and 5.0. They're rated really highly because they found that the information is so applicable to them and to their areas of practice. This one person said they worked in the military for 30 years and they still learn so much from the program. And I've heard that from people too that have been in the VA for decades. I find that the assignments in this program and doing the projects and the internship can help people in the VA move up the ladder and meet the criteria that you need to move up that nursing ladder to get to your next steps. It's just been, like I said, overwhelmingly positive. We do a lot of these Zoom sessions, so people really get to know each other. And one of the benefits that I've seen is that we form this kind of a community, and people can say, well, what's happening in your VA? Or this is what's going on with us. How are you dealing with this policy? And there's people in the VA from Hawaii and Alaska and Tennessee and Florida and Ohio and, obviously Colorado, but, there's like across the board, and it's really nice to get that pan perspective. But the bottom line is they feel like it's affecting the veterans and that their veterans are getting better in care and they care about their veterans. And I think one of the wonderful things about caring for our service members and our veterans is that they're willing to lay down their life for somebody. So they have a whole different sensibility about them. And I think we as nurses and healthcare providers, when we take care of them, it comes through to us too. And I think that makes our job extra special, and we care. We really care about what care we're giving them. So I thought I would play maybe just one video of a nurse. She was prior military and at the VA.
Hi, my name is Sonia Barnes. I am currently a registered nurse at the Denver VA. My practice area is the gastroenterology lab. I was looking to further my education, and I was looking at the CU website and came upon this program. After I saw, the pamphlets and things, no more contemplation was necessary. I decided to go ahead and go for it. I may be a little bit biased as I'm a veteran myself. I just decided what better way to serve my fellow veterans than learning more about them. I just read this quote a couple days ago, actually, from an unknown author. So the quote went something like, "A veteran is someone who at some point in their life wrote a blank check payable to the United States of America up and to the amount, including their life." So I work with veterans, and this statement alone makes me, it encourages me, motivates me, and drives me to learn how to better care for them. Besides that, at some point in your career, no matter what nursing path you take, you're going to encounter veterans. You're going to be responsible for their care. And personally, I would be thrilled if my care provider knew a little bit about veteran culture and what my background is. For me, it was a great learning experience in that I thought I knew a lot. Being in the military for 10 years, I thought I knew a little bit about veterans and military culture, but this whole program was definitely an eye-opener for me. Actually, scenarios and experiences that I had as a soldier, a lot were explained in this program. In addition, the things that veterans go through, the issues, the concerns, the trials, whatever veterans and their families go through, it was thoroughly explained, throughout this course. And like I said, it was definitely an eye-opener for me. Curriculum overall, I felt was very well organized. It was very well timed, meaning during a certain module, there were questions answered. You would kind of ponder over questions with your peers, and then you wondered what next. You had questions after that. So then you open the next module and your questions are answered. So that's what I mean by very well timed. Definitely this is something that I can take back and build upon. In my practice, in my career, well, first and foremost, I'm a patient's advocate. The things that I learned here, I have full confidence that I can go back and kind of be the up and coming specialist, so to speak, in this area as far as my workplace. We just got a new manager, actually, and she just recently voiced concerns over knowing about the veteran culture. She has no idea. So I feel like it's my duty to teach her these things. I think the eras, the different eras of veterans and the different wars and the corresponding conditions that go along with those eras really enlighten me. They open my eyes a bunch. Definitely that's something in your practice area, just knowing the different conditions that could exist with the different eras. I think the single most important thing to do is to ask questions, to really assess and ask questions, because a lot can be learned with simply by listening. And that's why I love working with the veterans now, is because I can relate somewhat. We have a camaraderie or a certain bond that nobody can understand unless they were a veteran. So I think this really unique population and caring for them is really important. It's important for people to learn more about them and their background and taking care of them.
I really love Sonia's story. She was one of the first graduates, maybe the second graduate of the entire program. So came when it was still very, very new. But she has been at the VA for 10 or 15 years and really saw the value in it. So I do think that, just in general, it's very an accessible program feel like it is very affordable, even at the out-of-state rate. It's engaging. You cannot help but be engaged with this program if you care about this population. Here are some contacts, and if you email me, you can Google the program or Google me and get my email. You can email me. China Hutchins is our advisor of graduate programs for master's, DNP, and PhD, and she's also a great resource for the PhD if you want to apply to that program. And then Ingrid Ischholtz is our certificate program coordinator, and she's in charge of our extended studies. So we have information online. All of their information is online as well. And I really thank you for being here, for listening, being so attentive and listening and taking care of our veterans. And yeah, if there's any questions, I'd love to take them. I love questions, so.
Well, thank you for the presentation, ma'am. I actually had some time to spend on the school's website, and I had watched the videos with Sonia and Allison Boyer and Jennifer Smith. So their videos were all very informative.
Great.
I will definitely, I'm going to take this information back and kind of digest it, and then maybe touch base with my points of contact in the VA with regards to either continuing ed, or it seems like we just passed the deadline for the NNEI. I can't remember.
I am not sure, because this isn't really starting till the fall. So if you,
Okay.
it wouldn't be for the fall, and different VAs seem to have different timelines.
Okay.
So
And
I
so
think nationally, that is not when it's due, but that might be when it's due in your VA. I can't really say that part, but there is generally still time. And I will do interviews as soon as, I'll start interviews almost as soon as the time closes, so that if we do need to submit any EI paperwork early, I can do that. I have had students who applied by December 15th and interviewed in January, apply for NNEI and get it. So.
Okay. Excellent. And I myself am a veteran as well, 26 years. I flew. Where did you fly at?
I flew out first out of Pope when I was active doing TACOVAC in the 130s. And then I flew out of Kelly, and I flew out of Maxwell.
Okay, excellent.
And then I did, so about 10 years of flying. How about you? Where did you fly out of?
Scott, and then I took a kind of an out-of-the-box job at an AMOC, an Air Mobility Operations Command in New Jersey. So I got to fly a lot with the Delaware Guard, and then a couple of reserve units there out in New Jersey. So yeah.
It's interesting. They do a lot of the AirVac. They really do. The Guard and Reserve, well, they have the majority of it in their system.
They do. They sure do. So huge appreciation for those folks.
Yeah, absolutely. I love that mission. I just loved it. That's a great mission.
Well, thank you so much. I'll definitely take a look at it, and I appreciate you doing the Zoom conference today and presenting all the information.
No problem. Take care.
All right, you too. Merry Christmas.
Merry Christmas. Happy holidays.
You too.
Bye. Christina or Rebecca or the person on 702 number, do any of you have any questions?
I don't. This is Rebecca. I came in late. Sorry. So will this be on the website to where I can go back and review what I missed?
Yes, I'm gonna, after we complete today, I will take the recording and I will post it.
Okay, great. Thank you so much. And thank you for doing this as well.
Thank you. I appreciate that. Thanks for coming. Christina, do you have any questions?
Hi, I wanted to say, can you hear me?
Yes, I can.
Oh, great. I wanted to say thank you so much for this information presentation, because I have to say I learned a lot and it sounds very exciting. Just like the person said before, I have to take in all the information and kind of look to see what's available at the VA that I work for. But
Mhm.
currently, I'm a nurse. I work as a Veterans Health Education Coordinator, and I feel like these classes will be so beneficial when it comes to educating veterans, understanding them more, and seeing just what are their needs and what I can do to better educate or better provide them services. So I have to say, this sounds very exciting. I didn't even know that anybody offered something like this.
This is a first program of its kind that's being offered. So, I mean, that's actually, and we really need it. Nobody's really looked at this as a specialty before. And in the very beginning, I was talking about my background, but I had this background in academia that was parallel to my military career. And so when I completed my military service, it just made so much sense to me that it needed its own degree. We need to really be able to study it and understand it and prepare our nurses and our graduate specialists, whether we call them clinical nurse specialists or advanced practice nurses or how we term them, but our graduate nurses need to have a more in-depth understanding. So I think you're right on. I think exactly what you're saying. As an educator, it's on us to help the other people there really learn about this.
Yes, I agree. I did have one question.
Sure.
How, I guess on average, how long does it take to complete, if you have a master's degree already and you're going for the DNP, how long does that usually take?
I really do a very comprehensive analysis of what you've already completed so that I can give you credit for absolutely everything that I can possibly give you credit for. I would say an average of 2 to 3 years to complete the DNP if you have, based on what you have done in the past. So it's, I wrote out there like 42 credits. If you have your master's and you have clinical credits that we can use, then I can I might not need to add any extra clinical credits to your plan of study. It's really just doing a really in-depth analysis, but you get all of the specialty content. That's really important. And that takes 2 years. So I would say 2 to 3 years.
Okay. Well, thank you so much. And thank you again for this. I hope you have a great rest of your weekend and happy holidays.
Happy holidays. Thank you.
Thank you.
Yes,
Hi, Dr. Trabo. This is Michelle Dunn that you spoke with last night, and I'm on the call on the 505-702 number.
Yep.
I just wanted to also say thank you for taking your time today to do this extra information because it was also beneficial to me, although I've watched the website as well. My only question is in reference to the continuing certificate and application for courses if we know that we're going to do this program. I've already turned in my application for the fall, but as I mentioned, my transcripts aren't in yet.
Yeah, that's fine. I saw
but I do want to.
We did receive it.
Okay, and I do want to just probably take a couple of courses in the spring. So I need to fill out the application for continuing ed, right?
Yes, fill out the application.
Okay.
At extended studies, and I coordinate with Ingrid every semester to say, okay, well, they've already applied, and so they know that you're planning to come into the degree program, and it's not a problem.
Okay, and then they'll know if we're part of the wiki. I think we are part of the wiki, but in Nevada. Yeah, I think we are. So that will be a tuition break as well. And I do think that nationally, the NNEI may be, this application cycle may be done, but I know they have another application cycle in the spring. So I will be applying for that as well, but I don't have it as of right now because I know our application cycle is finished at RVA. So thank you very much for the information, and I hope you have a nice weekend as well, and a nice holiday, and I think we'll be talking quite a bit.
Sounds great. Well, I welcome you, and I'm looking forward to us talking more and seeing you in class. So thanks, Michelle, for calling in again today. I appreciate it.
You're welcome. All right. Thank you.
Everybody have a good weekend. Bye-bye.